Drugs on Sex presents Stimulants. This podcast will focus on cocaine and amphetamines.
What are stimulants?
Stimulants are a category of drugs that increase activity at the brain and excite bodily functions, producing increased energy and alertness. Because of this, stimulants are sometimes referred to as uppers. So, how do they work?
Stimulants work by increasing transmission and release of neurons at monoaminergic synapses, which causes excitation of the sympathetic nervous system. Stimulant drugs enhance dopamine release or prevent reuptake, causing increased dopamine levels in the space between two neurons, which is also known as the synaptic cleft. The synaptic cleft is where the nerve impulse transmission occurs. Dopamine is important in the control of motor activity, reinforcement, and motivation. Increases in dopamine levels produce euphoria, activating of motor functioning, and reinforcement. However, if levels are too high, this can lead to dysphoric effects such as discomfort, anxiety, and restlessness. Cocaine and amphetamines can readily cross the blood-brain barrier, but cocaine is more lipid-soluble, so a higher concentration of cocaine can cross the barrier to enter the brain than amphetamines. Cocaine is a competitive reuptake blocker, meaning it competes with other monoamine neurotransmitters such as dopamine, serotonin, and norepinephrine to bind to the receptor. Cocaine has a very high affinity for monoamine neurotransmitter receptors, which means it will maintain a strong hold on the receptors, preventing other molecules from binding and entering the neuron. When cocaine is consumed, approximately 60 or 77% of the dopamine transporters are blocked.
As you can see from the image labeled A, normally the monoamine neurotransmitter dopamine binds to the monoamine transporter protein and enters the neuron, reducing the amount in the synaptic cleft. In image B, with cocaine, there are specific cocaine binding sites on the monoamine transporter protein. When the user takes cocaine, it'll bind to these receptors and block them, so that dopamine cannot bind or enter the cell as easily. Therefore, more dopamine remains in the system outside of the cell. In image C, with amphetamines, they bind to the monoamine transporter protein, causing the channel to stay open so that dopamine can easily leave the neuron. Amphetamines also enter the synaptic vessels inside of the neuron and cause an increase in the release of dopamine from the synaptic vessels. The increased levels of dopamine in the synaptic cleft due to cocaine or amphetamine use increases sensations associated with the reward system and can lead to high addiction or abuse potential. So, how does stimulant drug use influence addiction?
As we discussed earlier, cocaine and amphetamines activate the brain's reward system. This activation of the reward system and the responses it produces is partially responsible for the drug's addictive properties. Aside from the production of euphoria and intense pleasure, high doses of cocaine or amphetamines can also produce what is referred to as a rush, which is reported to have a strong sexual influence. With cocaine, the rush typically only lasts for about a minute, whereas with amphetamines, the rush typically lasts for 20 to 30 minutes. This rush sensation can be enough to encourage the user to continue abusing the drug. But when the user stops taking the drug, they will experience withdrawal with a significant reduction in circulating dopamine and a reduction in the positive effects. In withdrawal, the individual will no longer experience this rush sensation, thus interfering with their overall sexual desire and pleasure. This effect itself is enough to prevent the user from discontinuing their drug habits. How do cocaine and amphetamines influence sexual risk-taking behavior?
Studies show that the use of crack cocaine is associated with higher levels of risky sexual behavior, such as an increase in the number of sexual partners and a larger decrease in condom use than with other drugs. There is also an increased average of infrequency of sexual activity in those that take stimulants compared to those that only consume alcohol, which further perpetuates the risk of obtaining an STI as users are less likely to be using condoms. In addition, chemsex, for those of you that haven't heard of it, is the use of particular drugs in a sexual context, common among men who have sex with men, to increase pleasure and prolong sexual activity. Studies show that chemsex has increased in recent years, with cocaine being one of the most frequently used drugs in 23.9% of participants. The study also reported that amphetamine use, although less common than cocaine, has increased from 6.6 to 9.8% from 2013 to 2016. One of the major issues with chemsex is the increased risk of sexually transmitted infection, such as HIV. From 2013 to 2016, drug use, polydrug use, condomless sex with one or more partners, and self-reported STI diagnoses have all increased, demonstrating a correlation between these actions. From 2013 to 2016, the study also showed an increase in HIV testing and post-exposure preventative or treatment measures, which is helping to increase awareness of the implications of risky sexual behavior. Can cocaine and amphetamines be used in cases of sexual assault?
Yes, data published in 2018 highlighted drug prevalence in drug-facilitated sexual assault. Cases showed that 28.1% of the victims had cocaine and 19.2% had amphetamines in their system. Whether the drugs were taken intentionally or used as date rape drugs is unidentifiable. However, they are both soluble in water and alcohol, indicating the possibility of use for date rape. Even if cocaine and amphetamine consumption was intentionally, they can lead to sexual assault, as both cause lowered inhibitions, increased libido, and increased susceptibility to suggestion. How can cocaine and amphetamines enhance sexual function or cause sexual dysfunction?
There are many impacts of both short-term and long-term use of cocaine. Studies show that in the short term, cocaine use can actually benefit those with sexual dysfunction, as cocaine activates excitatory systems which can increase pleasure and performance in individuals. However, stimulating excitatory systems can also be detrimental to the user's sexual functioning. Studies show that long-term use of cocaine can lead to chronic sexual dysfunction, such as difficulty maintaining an erection and delayed ejaculation in males, difficulty reaching an orgasm in females, and general decline in sexual desire for users, even after discontinuing use of the drug. Approximately one-third of males dependent on cocaine have erectile dysfunction, which typically remains even after substance use stops. As you can see, cocaine and amphetamines have a high addiction potential due to their sexually enhancing effects, such as the rush feeling we described earlier. But with this, there are many complications that can arise, such as sexual dysfunction.
Thanks for listening. If you did not get a chance to see our last podcast regarding alcohol, follow the link in the description.